Bacterial meningitis is related to inflammation of the meninges of the brain and the spinal cord. The most common bacteria cause is Neisseria meningitidis, which is an aerobic bacteria that requires oxygen, and it is a gram-negative bacteria. And gram-negative bacteria can make endotoxins in the outer membrane of the cell wall, whereas gram-positive bacteria cannot make endotoxins and they do not have an outer membrane. And gram-negative bacteria have a thin peptidoglycan layer, so they have a thin cell wall, whereas gram-positive bacteria have a thick peptidoglycan layer. Then gram-negative bacteria can stain pink or red, whereas gram-positive bacteria stain purple. So the Neisseria meningitidis bacteria are transmitted through respiratory droplets, and they can infect the central nervous system, which can cause meningitis. And a complication could be that they enter the blood, causing septicemia, or in this case, since it's bacteria, it could be bacteremia, which is when the microbes or bacteria are in the bloodstream. And this causes it can cause a big systemic inflammation response, which can dramatically drop blood pressure from the vasodilation and loss of fluid through edema, and which would cause septic shock. So you can't deliver oxygen to the tissues because the blood pressure is so low. And the meningitis, to review again, is inflammation of the meninges. So if you recall, the cardinal signs of inflammation are heat, redness, edema, pain, and loss of function. So this will relate to the symptoms. And the symptoms are going to be severe for bacterial meningitis, and the onset will be rapid, which is less than 24 hours. So, since it's an inflammatory reaction, the inflammatory mediators can act on the hypothalamus to cause fever, and they can also increase vascular permeability, so the fluid would be leaked out of the blood vessels into the tissue, which could cause brain edema or swelling with the liquids. And then this extra liquid in the tissue can cause compression, which would increase the intracranial pressure, and this excess compression can cause pain, and a symptom could be a severe headache. And the compression can also affect the blood vessels of the brain, which would reduce the oxygen to the brain, which would be hypoxia. And if you have hypoxia, your mental status is obviously going to change. So some symptoms are decreased alertness, loss of consciousness, changes in mental status, vomiting, and seizures. And then the compression on the tissues can also damage the cranial nerves. And if the trigeminal nerve is affected, it can cause photophobia. Then the combination of the edema, pain, and damage can cause loss of function, and this can be seen with the nuchal rigidity, which the patient might report that they cannot flex their chin toward their chest because nuchal rigidity is a hyperextended stiff neck. And you can even try to flex the neck towards the chest, but if they have bacterial meningitis, they might exhibit the Brudzinski sign, in which when you flex the patient's neck to their chest, then they will involuntarily flex their hips and knees, and this kind of makes a B, so you can remember that that's Brudzinski's sign. And then Koenig sign is when the health practitioner lifts and extends one knee upward, and they try to extend it kind of like in a K motion. They probably won't be able to extend it this far, but just for the visual, the patient will feel pain because they're trying to protect their meninges and they can't bend their knee. And then diagnosis for bacterial meningitis, you would get their history, see if they've been living in close quarters, like in a college. You would perform a physical exam looking for a Koenig sign, Brudzinski sign, test their alertness and other symptoms. And then you want to test if there's bacteria, the Neisseria meningitidis, in a blood culture or a CFS, cerebral spinal fluid gram stain. And then you would want to test their intracranial pressure because the intracranial pressure increases from the brain edema. And then you would also want to get a CBC because since it's caused by bacteria, there would be high neutrophils and elevated white blood cells, which is leukocytosis. And then you could also perform an MRI or CT scan. And then you would want to get a cerebral spinal fluid analysis because if it's bacterial meningitis, the bacteria will eat the glucose, causing low glucose in the cerebral spinal fluid, and it will cause high neutrophils, and I think it's from the edema that causes high protein. And then inflammatory mediators from the inflammatory response, and there will be exudate. And then treatment would be, you would have to implement respiratory isolation since the Neisseria meningitidis is very contagious from the respiratory droplets. And then you would want to administer IV antibiotics and IV fluids since the fluids are being lost to the tissues through edema. You want to maintain their blood pressure with the IV fluids. And then you want to administer corticosteroids to reduce the inflammation and also administer pain medication and fever reducers. And then you would want to contact people that the patient was close with because they could have gotten the bacteria through the respiratory droplets, and the people would need to take prophylactic antibiotics or preventative antibiotics, and you would want to administer vaccines and teach the patient the importance of keeping up-to-date vaccines to prevent other bacterial meningitis.